Hello, everyone. I'm Michael Cope, and today I will be preparing our health district team to respond to hantavirus, a rare but serious disease that sometimes appears in rural areas across the Intermountain West. Our goal is to understand the agent, identify who is at risk, and review prevention steps to keep staff and community members safe. Hantavirus is a group of viruses spread mainly by infected rodents. In the United States, the main strain is sin nombre virus, carried by the deer mouse. People become infected by inhaling particles from contaminated urine, droppings, or nesting materials. This virus can cause hantavirus pulmonary syndrome, or HPS, a severe respiratory illness with a high fatality rate. McNeil and colleagues found actually that once symptoms begin, illness can progress very rapidly. Those most at risk are people in rural areas where deer mice are common, especially in older homes, barns, and outbuildings. Occupational exposure is higher amongst farmers, ranchers, construction, and environmental workers. In our clinics, maintenance and cleaning staff often face risk if rodent contamination is present. Outdoor recreationists cleaning cabins or sheds also become vulnerable. Identifying these groups helps focus prevention and PPE training. When hantavirus is suspected, testing is done through state public health labs or the CDC. Routine hospital labs rarely test for it because of biosafety level 3 requirements. Clinicians collect samples and report suspected cases immediately to state health departments. The CDC Viral Special Pathogens Branch confirms results using ELSA or PCR testing. This ensures accuracy and keeps staff safe. The incubation period for hantipulmonary syndrome is 1 to 8 weeks after exposure. It's important to know that humans don't transmit the virus to each other. Infection only occurs from rodent contact. Symptoms start with fatigue, fever, and muscle aches, and then progress to shortness of breath as lungs fill with fluid. McNeil and colleagues emphasize the early recognition and immediate medical evaluation, especially for rural patients. Although rare, hantavirus has a fatality rate of about 35% in the United States. McNeil and colleagues, as well as Johnson and colleagues, found similar global trends, confirming how serious it can be without early treatment. Rural communities face extra challenges due to limited access to care and frequent contact with rodent habitats. Increasing awareness, therefore, helps us detect cases sooner and reduce both illness and fear. Prevention starts with safe cleaning. Before cleaning, folks should air out a space for 30 minutes. Should never sweep or vacuum droppings because that spreads particles. Use of a 10% bleach solution is recommended. Let it soak and then wipe with disposable towels. Wear gloves, an N95 mask, and eye protection. After cleanup, double bag the waste, disinfect tools, and wash hands. Important, we should seal all entry points and use traps to prevent further infestations of rodents. Public education is essential. Many exposures happen when people reopen cabins or sheds. Since hantavirus is nationally notifiable, suspected cases must be reported right away. Prevention requires coordination amongst environmental health, clinical staff, and global health agencies. Globally, as Johnson and colleagues note, other rodent-borne viruses continue to emerge, emphasizing a need for surveillance and outreach. In closing, remember that hantavirus infections are rare but potentially fatal. Awareness, early recognition, and protective habitats remain our best tools. Public health preparedness depends on education, environmental control, and rapid reporting. Together, we can protect our staff, patients, and communities across the Intermountain West. For those who'd like to learn more, the references at the end provide a strong starting point for further reading and additional professional development. Thank you.